Our next session is The Price of the Trail, Navigating the Costs of Lung Cancer. We are joined today by Triage Cancer's Senior Staff Attorney, Amanda Goodstadt. Amanda provides legal and financial navigation to survivors coping with cancer. Drawing on her personal caregiving and cancer experiences, Amanda is committed to helping others address the practical and legal challenges of cancer diagnosis. Our survivor friend, Terry Gillespie, wave Terry. Terry's up at the front. Terry will moderate the Q&A, so get your questions submitted. Additionally, friends, remember that you can upvote those questions. Maybe you're looking at the incoming questions and you think, well, that's good. I want to know that answer also. Make sure that you click on the thumbs up and we'll make sure and prioritize those great questions. Join me in giving Amanda a big welcome.
Hi, everybody. Thanks so much for coming. Could I get the slides? Anyway, as Christy said, I am with Triage Cancer. Triage Cancer is a national nonprofit that provides free education on legal and practical issues that can impact people who are diagnosed with cancer and their caregivers. We provide that education in a wide variety of ways. I do have a table outside, and I know some of you have stopped by. But for those of you who are not familiar with us, we do a lot of presenting educational events. We have a lot of educational resources, written resources, videos, animated videos. We have a podcast. We really try to reach people in whatever way they're most comfortable learning. And I'll share a little bit about some upcoming events at the very end today. Yep. Oh, sorry. There we go. All right. So obviously we're all here to talk about the cost of cancer. And when we're talking about the cost, we're talking usually about a concept called financial toxicity, the negative financial consequences that are caused by the diagnosis or that are exacerbated by the diagnosis. And unfortunately, financial toxicity can be every bit as serious as physical toxicity. And not only does it impact the person with the diagnosis, it can impact their entire family. One of the reasons this is such a tough problem to solve is there are a lot of factors that can contribute to someone's financial health. At Triage Cancer, we believe that the most significant contributor is health insurance status. And when I say that, I don't just mean does someone have health insurance, I mean, do they have adequate health insurance? Do they know how to navigate that health insurance in order to access the care that they need and to reduce costs? Of course, health insurance status isn't the only contributing factor. Employment is another significant contributor to financial toxicity. Is someone still working when they're diagnosed? If they are, do they have strategies to try and continue to work, to continue to earn an income? Do they have access to time off? And then eventually, if they are unable to keep working, do they have access to disability insurance? And then on top of that, there are all the other life changes that continue to happen despite the fact that someone has a diagnosis, right? People continue to get married, or they separate, or they divorce. They move. They have children. Those children grow up. Maybe they go to college. So all of these things are happening in someone's life while they are still managing the cost of this diagnosis. I have a really short time to speak today, and so what I decided to do was try and illustrate some of the topics that we talk to people about and some of the strategies that we try and share with people through an example. So meet Maria. Maria is 58 years old. She recently began treatment for lung cancer. While she's focused on her health, she's also juggling many challenges outside of the hospital. Shortly after her first chemo appointment, Maria received a medical bill that she wasn't expecting and couldn't afford. Already worried about her treatment, this unexpected expense caused her significant stress, and no one can tell her how much her treatment's going to cost. At the same time, she's been facing pressure at work. Her employer had been supportive initially, but now that she needs more time off for appointments, she's starting to worry about losing her job, which is how she gets her health insurance. So I would imagine that at least one of the concerns that Maria has may resonate with some of you. So let's start off with the concern about the cost of treatment and the fact that she doesn't understand what all of this is going to end up costing her. This time, though, no one can tell her how much, despite the fact that she feels no one can tell her how much money her treatment's going to cost. The doctors have told her she should be done with treatment this year. So that leads us into the confusion people have about the cost of their health insurance. Because unlike if I walk out into the Galleria to buy a new shirt where there's one price tag that's attached to that shirt telling me what it's going to cost, health insurance doesn't come like that, right? There's not a sticker price on the top of your policy. You have to understand this whole language around health insurance. This slide just contains terms that are used to describe what it costs. These terms are used no matter how you get your insurance, whether you have an employer plan, whether you've got a marketplace plan, whether you have Medicare or Medicaid. The first term to really understand here is the term that describes what it costs just to have the health insurance, whether you're going to use it or not. That's your premium. It's a fixed dollar amount. You're paying it each month. But then on the other side of the slide, you have a whole bunch of terms that describe what happens when you start to use the health insurance that you purchased. The first of those terms is deductible. That refers to the amount that someone has to pay out of their own pocket before their insurance kicks in and starts to share costs. It's a fixed dollar amount. Sometimes it's a super high amount, but sometimes it actually can be a low amount or even zero, meaning the plan starts to share costs the first time you use it. Then there's a cost each time you get anything. Each time you go to the doctor, each time you have an x-ray, each time you fill a prescription. That's described either as a fixed dollar amount, in which case we call it a copayment or a copay, or it's described as a percent of total cost, in which case we call it a coinsurance or a cost share. And then the final term that people have to be comfortable with is out-of-pocket maximum. I talk to a lot of people who can get confused between deductibles and out-of-pocket maximums. An out-of-pocket maximum represents the most someone is going to have to pay for their covered expenses for the year. Once they hit their plan's out-of-pocket maximum, the plan takes over and pays 100% of covered expenses. You have to look at your plan, though, to know both the amount of your out-of-pocket maximum and to know what expenses you get to add up to see if you've hit it. So in Maria's case, we're going to pretend that her plan lets you add up everything you spend on your deductible, all your copays, and all your coinsurances. Her plan has a $2,000 deductible. It's an 80-20 coinsurance. The plan pays 80% of covered costs. Maria has to pay 20% out of her own pocket. And it's got an $8,000 out-of-pocket maximum. I chose pretty simple numbers to go along with my comfort with math in front of big groups. Maria ends up with a $102,000 hospital bill at the beginning of the year. What is she going to have to pay, and why does she have to pay it? So she's got to pay the first $2,000. That's how she satisfies her deductible. Her plan is not going to kick in and start to help with costs until she's paid that. Then that leaves a $100,000 balance. It's an 80-20 plan, 80-20 coinsurance. So she's going to owe 20% of $100,000 or $20,000. But the plan's got that $8,000 out-of-pocket maximum. Her payment towards her deductible, that first $2,000, counts to start getting her to the $8,000. But she's still got $6,000 to go. And that is all of that remaining $20,000 that Maria will have to pay. So when she thinks about, ooh, like I don't know how much this treatment's gonna cost this year, as long as her costs are covered by insurance, she does know. She's gonna have to pay $8,000 out of her own pocket, plus she's going to have to pay all of her premiums. So whatever the monthly amount is times 12. Now, let's turn to another issue that people talk to us about. Maria gets a medical bill she wasn't expecting and she can't afford it, and it turns out her insurance company claims that the drug she needs is experimental for her condition and it denies coverage. That leads us to another topic that we talk to people about all the time, which is appeals. You do not have to take no for an answer if your health insurance denies coverage for something. For most consumers, for most types of health insurance, people have two opportunities or two rights to appeal. They have an internal appeals right, where they go back to the insurance company that said no and ask the insurance company to reconsider. And they have an external appeals right, which is where you can go to an independent medical review organization and ask that independent entity to look at what the insurance company said and let you know if it agrees. Now, I get the fact that by asking people to do this and go through this process, we are asking patients and sometimes caregivers who already have more than enough on their plates to do yet something else. But what we also know is there are a lot of studies out there that share that anywhere between 40 and 60% of denials from insurance companies were incorrect. So if I just even take the median there and I say around half the time, if an insurance company is getting things wrong, there's a decent chance that by taking the time to appeal, you can end up accessing the care you need or end up getting it covered. But despite that, very few people appeal. A lot of people don't know that they have appeals rights, and even the people who know they have them, many of them don't take the time to go through this process. And I like to use this study that KFF did. This is from 2023. The blue circle represents more than 48 million denials just from marketplace plans that year. The white sliver at 12 o'clock, that represents the 1/10 of 1% of those claims where someone appealed. So when we're talking about accessing care or reducing costs, appeals are a hugely underutilized tool that people have. We have a lot of resources about appeals. The process for appeals can differ depending on how you get your insurance. We have a brand new tool called our Triage Health Appeals Navigator, which uses AI that's trained on our content to help you if you want to get assistance in writing a first draft of an appeals letter. Now Maria gets a bill that she wasn't expecting and couldn't afford, and she doesn't even know what the bill is for. This is another issue that people will talk with us about. Obviously, there's a flurry of mail when you get treatment. You get communications from the insurance company, from the providers. They don't all happen in this right order. They don't all happen even close in time to when you got care. We talk to people a lot about explanations of benefits, which are those statements that the insurance company sends you showing a provider has made a claim and what the insurance is going to pay and why and what they think you may owe and why. We encourage people to always be matching their bills against their explanations of benefits and to not be shy about asking questions if you see things on those documents that you don't understand. We also want people to understand that if you're being treated at a not-for-profit hospital, not-for-profit hospitals are obligated to offer charity care programs, both for people who don't have insurance and for people who have it, but it's not covering all of your costs. We work with $4, which is a great nonprofit. All they do is charity care and helping people find their hospital's policies and helping people apply. This time Maria gets her medical bill, and it turns out her oncologist is no longer in network for her plan. People will call us and they want to know what if anything can I do in that situation? So we talk to people a lot about enrollment periods and when they can make changes to their health insurance coverage. Depending upon how you get your coverage, those periods of time vary. I want to just highlight a couple of things on this slide. One is that Medicaid, if you need Medicaid and you are eligible, you can apply year-round. There's no enrollment period for that. Employer plans, it'll vary depending on the employer. A lot of times it's in the fall because that coincides with Medicare and the Marketplace. I'll just highlight the Marketplace enrollment period is changing this year for anyone who gets their coverage that way. Up until this year, states could be a little bit different about when open enrollment happened, but as a result of the Budget Reconciliation Act from last summer, beginning this fall for 2027 coverage, all states are going to use the same open enrollment period from November 1st through December 31st. So it's going to be a little bit shorter than it has been in the past. Of course, people don't always have changes happen at times of the year that, it's not always in the fall. There are a lot of special enrollment periods people can take advantage of. They differ depending on how you get your coverage. Some forms of coverage have many, many of these, but sort of the general answer or the general comment here that I'll make is when you have a loss of other creditable coverage or when you have a life-changing event, like you move or you get married or divorced or there's a death of someone on a policy, those typically will trigger a special enrollment period where someone can reevaluate coverage and potentially make a change. We think that choosing and using health insurance is so critical to saving money or potentially saving money. We have a lot of resources just around this topic. We have an animated video about picking a plan that goes through how to do the math to compare different plans. And we have a worksheet and calculator where you can also plug in the information about plans you're considering. And then we have a version of that worksheet and calculator specifically for Medicare because there are different nuances involved. I want to now turn to some of the non-health insurance related issues that we talked to people about. So for Maria, she's facing that pressure at work. She's worried about losing her job. We talked to people about employment rights quite a bit. I know there was a whole session earlier today on work and cancer. We talked to people about sort of the legal side of that. So we'll talk to people about fair employment laws, which are the laws that prohibit discrimination in the workplace based on someone's medical condition. Those are also the kinds of laws that provide access to reasonable accommodations. We talk to people about leave laws, which are laws that specifically allow people to take time off and protect their jobs, and sometimes also protect health insurance status. Fair employment laws and leave laws exist at the federal level, meaning there are laws that apply equally across the country, but they also exist at the state level and sometimes at the local level. So it's important to know what's available to you depending on where you are. On top of the laws, some people work under the terms of an employment agreement, and that employment agreement will either give them additional rights or it may limit certain rights. And if you're a union employee, that's what happens with your collective bargaining agreement. That's where to look to see whether you might have additional options available to you or whether some of the options available to you are more restrictive. The laws only provide a bare minimum of what employers are required to provide to employees. So it's also very important to be looking at employment policies to know what your employer offers. Do they offer insurance beyond health insurance? I talk to a fair number of people where if I say, does your employer offer disability insurance? They don't know. And I completely understand that because usually that's the kind of thing where you fill out paperwork when you're onboarded and then you forget about it unless and until you end up in a situation where it's something you'd like to have. Employer policies are also where you're going to find out whether you have access to paid time off or other creative arrangements like pools of donated hours or flex time. All of these things can be helpful in allowing someone to remain working for as long as they're able to. Now, sometimes, obviously, even with all the reasonable accommodations and even with employers who are very much wanting to help and provide options, someone finds themselves in a position where they can't keep working. And that's where we talk to people about disability insurance, some sort of cash benefit that replaces part of wages and can be used for daily expenses. There are really just 3 places in the US to access disability insurance. The first is privately, which either means you purchased a policy on your own. More likely, we talk to people where a policy was purchased by an employer and it's one of their employment benefits. Second place people can look to for disability insurance is their state, but only if they're in one of the states listed on the slide. Very few states have disability programs. Each of these states that does have a program operates it a little bit differently. The one thing they have in common is these are all short-term programs. So at most, someone would be able to get a year of benefits from this kind of program. The final place people look to for disability insurance is the federal programs. Often these are the ones that are most well known by people. SSI, or Supplemental Security Income, and SSDI, or Social Security Disability Insurance. They are both administered by the Social Security Administration. They both have a very high standard for disability. It requires someone to have a condition that's lasted or is expected to last at least a year or result in death. And that condition has to cause that person to be completely unable to work. SSI is different from SSDI in certain ways. SSI is directed at people who have very low income, very low assets. SSDI, think of it as a way to access your retirement benefits early because you've become unable to work due to your disability. I will say that often when I speak to people about finances, or that's like in the title of what I present, people assume what I'm going to be talking about is financial assistance. Like, are there grants out there? Who are the organizations that have money? We do have a lot of resources about that, and we do talk to people about strategies for applying for financial assistance. But it's all those other topics I just talked about that we really try and focus on with people, because as many organizations that are out there doing wonderful work trying to provide financial support to the cancer community, there are just still more people who need that money than there is money. When we talk about trying to compare health insurance plans to save money, trying to continue working, or accessing a steady monthly disability benefit, we are trying to find ways for people to maximize ongoing streams of income or to reduce big sums of money. And often that can more effectively help out from a financial perspective than finding a single one-time grant with an organization. I will just end before I do questions, just with a little more information about some of the things we do. We do have a conference of our own coming up. It is virtual, it's free, it's 2 half days in about 2 weeks, where if you're interested in the topics that I really just did a very quick introduction to, we will be going into much more substance about different forms of health insurance, managing medical bills. We'll talk about employment rights in much greater detail, talk about disability insurance in greater detail, as well as do a segment about estate planning. We also have a brand new program we're doing in partnership with the Bright Spot Network for parents with metastatic cancers. It's a multi-part webinar series, and if you sign up, you also will get a box in the mail, both a box from us with some of our educational materials, and Bright Spot Network is sharing some art projects and books for young children. And finally, I will say, for those of you who may have questions of a more personal nature or sort of like extended questions with lots and lots of detail, or for those of you who don't right now but may find yourself in the future looking at our resources and saying, okay, this is great, but I can't figure out how this applies to me, we have an individualized legal and financial navigation program. We talk to patients, we talk to caregivers, we talk to healthcare professionals about a wide array of issues, but the ones that I covered today are kind of the main ones people call about. We don't do legal representation or legal advice, but what we will do is we'll try and talk through the problem you're experiencing and share information about what the law says and try and identify whether there are options out there and pros and cons of different options to try and empower you to take next steps. So if that's something of interest, you get started by going to the link you see on the slide. Programs available in both English and Spanish. You fill out a form, you submit the form, you'll get an email back from us with a link to our calendar. You can choose a time that works for you. At that time, you'll get a call from one of our attorneys, and we'll go from there. One of the things we can do through that program is for those of you who would like to talk with a certified financial planner, we have a network of volunteer financial planners who will provide 2 free sessions to folks to talk about things like, how do I budget on a limited income or a more limited income than I'm used to? How do I plan for retirement given what's going on right now? How do I manage debt? So if you're interested in that, once you've spoken to one of our attorneys, we are not financial planners, but we will try and connect you with someone who can provide that service. And with that, I will just say thank you so much, and I'm happy to take questions if there are any.
I want to thank Amanda for her expertise in this, and let's give her another round of applause because she really deserves it.
Thank you. Thanks.
I'm Terry Gillespie. I'm your moderator. I'm a monitor too, but anyway. The first question is, what is the best way to make sure my providers are in network when switching health insurance plans?
It's a great question. The best way is by speaking directly to the providers. And by that, I don't mean the doctor themselves, but the person in their office who handles business matters. A lot of times you can start out on your provider's website. If it's like a big health system or a big practice, they'll have a section on their website that says which insurances are in network. I would just encourage people to always call and ask and just check that whatever's on the website is accurate. And also be really careful when you do that to not just call and say things like, do you take Marketplace? Or do you take Aetna or Blue Cross? I'm randomly choosing those companies. Every one of those insurance companies has thousands of products. So you want to be very, very specific with whatever letters, numbers, whatever code is associated with the plan's name, and verify. And I always recommend just taking a note of who you spoke to and the date. Obviously, the insurance plans also have directories of who is in network. I just think your best bet is looking in all the places and then confirming with a human being.
Thank you. My next question or statement, it's very important to talk about the possibility of having VA paid too. If the veteran has been exposed while in the service and later receives a lung cancer diagnosis, it is important the veteran sign up with the VA as soon as possible for disability benefits and care.
Totally agree. If someone, and in fact, when we do the questions, we ask people when they contact us, one of them is, are you a veteran? But certainly for someone who's eligible for veteran benefits, that is a wonderful source of support.
Thank you. The next one is, what is the difference between Medicaid and Medicare?
Another really good question. So both Medicaid and Medicare are public insurance, right? They're insurance from the government, but they're for different groups of people. Medicaid is a program that is for people who, by and large, have low income and sometimes low resources. Medicaid is a federal-state partnership, and because of that, every state has a Medicaid program, but every state can operate their Medicaid program differently. And so when you have questions about Medicaid, it's super important to make sure you are looking at the Medicaid program for your state. Medicare is public health insurance for people who are either 65 and older, or they're under 65 and have been getting Social Security disability insurance benefits for at least 2 years, or for people who have ALS or end-stage renal disease.
Thank you. If your medical team is no longer in your network and you can't change insurance companies because it's not open enrollment, at that time, is there a way to continue seeing the medical team without having to pay the extra money because they're not in network anymore?
So options in that situation are going to differ depending on how the plan you're leaving is structured. There is a provision in the No Surprises Act for continuity of care, which allows someone with a plan covered under that law to continue paying in-network rates to see that provider for 90 days. Obviously, some of the options there are going to depend on how close are you to a period of time where you can make a change. They're going to depend on whether the plan you have has any out-of-network coverage, and maybe you're able to continue seeing that provider, but eventually it's going to be at a higher rate. And also it's going to depend on what your provider may agree to in the future.
Thank you. Okay, can you collect SSDI and retirement?
It's a question we get asked a lot. So the answer to that is SSDI, which I briefly mentioned, right? Think of SSDI as a way to access your retirement benefits early, because you essentially are retiring early because you can't work anymore due to your medical condition. If you access SSDI, let's say you're on it right now, when you hit your full retirement age, you still get that same amount of money. It's just that Social Security is now going to call it your retirement benefits and not your disability benefits. There are, though, for some people, depending on what their age is when they go to apply for SSDI, they may be able to apply for SSDI and for early retirement and get early retirement until, hopefully, they're approved for SSDI. That's a little bit more complicated of a situation, but the general answer to that question is, once you've hit full retirement age, there is no more Social Security disability. You're just getting the same amount, but it's retirement benefits and no longer considered disability.
Thank you. The next question's kind of on that one. Should SSDI before full retirement age be the same as the full retirement benefit?
Yes. So when you apply for SSDI, if you look at your My Social Security account and you look at what your retirement benefit would be at that point if you hit age 67 or whatever your full retirement age is, then yes, it's that same, it's a way to access full retirement benefits, as opposed to, let's say you're 62 and applying and you don't go the disability route, you just say, you know what, it's easier, the standard is just my age, you'd be getting the reduced amount.
Thank you. To file for SSDI, do you have to have stopped working for 6 months prior?
No, there's no bright line rule like that, but part of the standard, so I had mentioned Social Security has a really high standard for someone to meet to be considered disabled. And the way I explain it to people is, it's not just about what you have. It's not about like, okay, what's your diagnosis? And based on that, I'm going to decide whether you're disabled or not. It is a functional definition. It is, how does that diagnosis impact your day-to-day life such that you're not able to work? You're not able to go back to whatever work you were most recently doing, and you can't adjust to any other kind of work. And I'm sorry, I went too far back.
They took the question
The
away.
6 months. There is
Yes,
no
6
bright line rule like that. But when you first apply, one of the first questions is going to be, are you still working? And if you're working, how much money are you making? And if the answer to that question is, yes, I'm still working, you're going to have to be prepared to explain to Social Security, well, why is it that you're asking for a benefit that means you're totally unable to work, but you say you can work? So practically speaking, most people who are applying for the benefit and who are going to be successful in getting the benefit are people who aren't able to work and are showing that they're not able to work. Unless there are some kind of specific situations, like someone who is working right now, but in 2 weeks they're scheduled to have a bone marrow transplant, right? And they know that by definition, that's going to be a year's worth of being in the hospital and unable to do anything. But it is very hard to argue to Social Security that I am totally unable to work while saying that you're able to work. Does that make sense?
Yes. The next question is, if you're on SSDI and Medicare, can you get Medicaid?
Yes, if you're eligible for Medicaid in your state, you absolutely can.
Thank you. The last question. My wife is currently covered by COBRA and has a several-month gap between COBRA termination and Medicare. What are some of the best options for this gap, and is ACA a viable option, particularly given the behavior of the current administration?
So there are a few potential options, and I'm going to just stress there's nowhere near enough information there for me to know what direction for someone to go in. But one thing is, for someone who gets a disability determination from Social Security that confirms that they were disabled by Social Security standards within the first 60 days that they had COBRA, they actually can get a COBRA extension. It's one of the few circumstances where that can happen. So potentially, depending on a lot more information that I don't know, that could be something to look at. The marketplace could be something to look at. Medicaid could be something to look at, depending upon the household income and resources and again, other factors. But certainly there are potential options.
That was the last question. Thank you, Amanda, so much for sharing your expertise, and thank you, everyone, for your great, great questions. I guess that's it.
Thanks
Unless
so
there's, do we ask any?